Sorry, friends. What are the expected positive changes in the client? When you give counseling, the expected changes are: one, a deeper self-knowledge. Self-knowledge means Vikti tana bagge tane tilukuluvodu. The person understands his own assets, his own liabilities, what he can do, what he cannot do. It is self-understanding. A change of attitude, a positive attitude comes. A modification of self-perception, understanding self, a modification of the perception of others. These are all the positive changes expected of counseling. Now, next one is there any difference between counseling and psychotherapy? Are they one and the same? There is a difference. Some others say that there is a difference between counseling and psychotherapy. Psychotherapist. Psychotherapy is different from counseling, but some others say that both are one and the same. But professionally trained counselors and psychotherapists do not try to make a distinction between the two. They practice their own. This is different from that. But psychotherapy is different from counseling. Most psychologists today would agree to a difference of degree rather than of kind. Psychotherapy is mostly provided by psychiatrists, clinical psychologists, and psychiatric social workers because it is a therapy. Therapy means treatment. It is more intensive. Psychotherapy is more intensive, more in-depth. You go into the mind of a person, whereas counseling deals with the superficial things. The goal of psychotherapy is to bring about desired change in neurotic patients, alcoholics, drug dependents. This requires many sessions and it may last for months and sometimes years also. Whereas personal counseling, on the other hand, is practiced by counseling psychologists, marriage counselors, family counselors, social workers, and teachers. So we practice counseling. Those who are specially trained in psychotherapy, they practice counseling, psychotherapy. Psychotherapy is a treatment technique used for mental health problems. People who go for counseling are normal people. Normal people, those who have problems of day-to-day living. Those who have economic problems, those who have interpersonal problems, those who have adjustment problems, those who have occupational problems, and those who have family problems, those who have marital discord, those people go to a counselor. Severe problems like neurosis, psychosis, neurosis, alcoholics, drug dependents, they go to a psychotherapist. So that is the difference between the two. So counseling and psychotherapy are not one and the same. Next comes, what are the requirements of a counseling profession? I say that you are all potential counselors. What are the requirements? At international level, I will explain one by one. If you want to become a counselor, what is required is well-balanced personality. Well-balanced personality means you should not be a short-tempered person. If you are a short-tempered person, you may not fit well for counseling because sometimes you may show emotions on the client. So it is not a good requirement. So it is not a good quality. So well-balanced personality is required. Patience is required. Second is superior intellectual ability and judgment. You should have exceptional qualities, especially in memory, reasoning, learning, ability to find and solve problems, updating your knowledge, ability to think rationally, and ability to take decisions. If you have all the qualities, excellent. Third one is curiosity to learn things, updating your knowledge. That is required. Fourth one is interest in persons as individuals. Consider every person, every client as an individual. A regard for the integrity of others. Treat everyone with respect. Respect their dignity. Next is insight into your own personality characteristics. Understand what type of person you are. If you are a well-adjusted person, definitely you are good. If you have a sense of humor, excellent quality to become a counselor. It is always better if a counselor is always having a smiling face. A smiling face. Nagumukha annavadu. Tolerance is required. No arrogance. Tolerate the work pressure. Jasti kelsa iddarunu, if you are able to manage the work, you are a good counselor. Ability to establish warm and effective relationship with others, that's what we say rapport. You should be able to get along with the different categories of people. If you are able to establish a relationship with the people, if you know how to talk to people, if you know how to greet people, it is good. Methodological work habits. Methodological, perfectly you have to say 10 o'clock I start, 2 o'clock I stop, 5 o'clock I stop. Methodological work habits. Be flexible. When situation warrants, you have to work. Acceptance of responsibility. Be optimistic and hopeful. Integrity, that's what we say, honesty. Self-control. Stability is therapy. Ethical issues of counseling respect the cultural practices of others, even if those practices are not of your liking. Respect the culture of people, respect the practices of people. The last requirement is educated person qualification. We have 12 requirements, you have 11 requirements. If you want the 12th one also, you can get it. Okay. We have Manasa Nursing Home in Shimoga. They offer diploma courses, online courses, 1-year courses on counseling. You can definitely join that course and they don't charge also much. You can acquire a good qualification with the reading material and they conduct good classes also, friends. Okay, next, we have a problem-solving approach. What is this problem-solving approach? This is called as IDSO model of problem-solving. The first thing is A stands for awareness. Become aware that you have a problem. This is the first one. I have a problem. If I know that I have a problem, that's what we say technically called as insight into my own problem. I know that I have a problem. There's always a good indication. I have a problem. I am not like others. There is something wrong with me. I have to get rid of this problem. Second is I get information about the problem. Get as much information as possible about that before you resolve it. Third one is definition. Define the symptoms, causes, outcome, and constraints of the problem. Find out the options, find out what are the options available to solve the problem. Select the most suitable solution. And E for execution, implement the selected solution. This is a business psychologist version of problem-solving approach. Coming to the types of approaches of counseling, which method you have to follow if you practice counseling. Broadly, there are three types or three approaches of counseling. Two approaches are very, very popular, and third is not an approach developed by anyone, but I will explain that also. First one is the directive counseling. Directive counseling, and it is not direct, it is directive, giving direction. That's the meaning. Giving direction to the individual. Do what I say. This is called direction. The founder of this is Williamson. It is counselor-centered approach. It is based on the assumption that the client cannot solve his own problem because he lacks competencies, he lacks information, he lacks experience. We always believe that the client cannot manage his own problem. He is innocent. He is ignorant. So hence, what counselor does is, he will ask the person, what is your problem? The client will explain all his problems. Afterwards, the counselor will analyze the problem, find out the causes of the problem, and find a solution to the problem. And he will inform the client that this is the solution. I will give you the solution and follow whatever I say. I will give you a solution for your problem. Because I am knowledgeable, because I am skillful, I know things well, I can guide you well. Do what I say. This is counselor-dominated counseling. It is called as counselor-dominated counseling. Counselor is a supreme. Counselor, just 1 minute, please.
ಡಬಲ್ ಕ್ಲಿಕ್ ಮಾಡಿದ್ರೆ ಮತ್ತೆ ಮೂವ್ ಆಗುತ್ತೆ ಸರ್. ಅದು ಸ್ವಲ್ಪ
ವೈರಸ್ ಅಂತ.
ಹೌದಾ ಸರ್, ಏನಿಲ್ಲ, ಓಕೆ ಓಕೆ ಮತ್ತೆ ಆಗುತ್ತೆ ಸರ್, ಏನಿಲ್ಲ.
ಸರಿ,
ತೀರಾ ಸ್ಟ್ರಕ್ ಆದ್ರೆ ಸರ್ ಏನಿಲ್ಲ, ಇದ್ರ ಮೇಲೆ ಡಬಲ್ ಕ್ಲಿಕ್ ಮಾಡಿ.
ಸರಿ ಸರಿ, ಓಕೆ.
ಇಲ್ಲ ಕರೆಕ್ಟ್ ಸರ್.
One person in last time asked one question, which method of counseling is good? Is it online counseling or offline counseling? My answer is offline counseling is much better. Online counseling, this type of problems only will come. Okay, friends, directive counseling means it is counselor-dominated counseling. The counselor knows how to help an individual. He is knowledgeable. His focus is on the problem, not on the person. And he will give you a solution. And the role of client is to just follow whatever he says. This is one type of counseling. Here, in this type of counseling, the counselor is authoritative. The counselor is knowledgeable. The counselor knows. He will give you a solution. He will give you direction. He will show you the way. Your role is just to follow whatever he says. Okay, summary of directive counseling is solution of the problem is counselor's responsibility. I take the responsibility of solving your problem. Status, the counselor is supreme and knows what to do. I know what to do. Role, the counselee is psychologically dependent on counselor for choosing a solution. The client depends on the counselor. Whatever he says, you follow. Emphasis will be on surface symptoms. Solution of current problem is most important. This is a summary, one form of counseling. This type of counseling is well suited in many conditions. Some people are very ignorant, innocent people. They have a problem. They don't know what to do. They don't have the capacity to analyze the problem also. In those cases, we'll tell them what is to be done. That's called directive type of counseling. Non-directive type of counseling, it is also called as client-centered counseling. In client-centered counseling, the terms counselor and client are used. In this type of counseling, the counselee or the client is very important. He talks more. He talks more. And he will explain his problem. He will explain everything. The role of counselor is to just listen to him. Listen with attention and listen with concentration. Client is more active than the counselor. So the way the counselor makes no attempt to influence the proceedings directly. We believe that every person is capable of analyzing his own problem, deciding his own course of action. Non-directive counseling, we believe that client can manage his own problem. So what we do is we ask him to explain his problem. We only enable him to analyze the problem. And finally, we ask him to give solution to his problem only. Whatever solution he gives, we accept it and we facilitate it and we encourage, we motivate also, because we believe that client is capable of taking a solution on his own. He has the strength, he has the ability. It is exactly opposite of earlier counseling. With regard to responsibility, solution of the problem is counselee's own responsibility. Status, the counselee is equal to or sometimes more important than the counselor as a person having the problem. Role, the counselee is psychologically independent. Method, the counselee primarily controls the direction of conversation and does most of the talking. ಜಾಸ್ತಿ ಮಾತಾಡೋರು ಯಾರು ಅಂದ್ರೆ ಕ್ಲೈಂಟ್, ಜಾಸ್ತಿ ಆಲಿಸೋರು ಯಾರು ಅಂದ್ರೆ ಕೌನ್ಸಿಲರ್. The counselor will not dictate anything, will not show anything, will not direct anything. He will only listen. And he will listen, he will encourage you to talk. Even if you don't talk for some time, we will also keep quiet because probably you want some silence. It is counselee dominated therapy. The first one is, it is counselor-dominated therapy. In the first form of counseling, the counselor is more important. In the second form of counseling, the counselee is more important. In the third form of counseling, that is called as eclectic approach. Eclectic approach means this is not an approach developed by anyone. The earlier one, that is non-directive counseling, is otherwise called as client-centered counseling, developed by Carl Rogers. He developed non-directive counseling, very popular in the USA. The first one is Williamson. The third eclectic approach is not developed by anyone. It is not an approach also. One should not be fanatic of any particular method of counseling. Counseling is not a predetermined or prescribed activity. Clients are not fitted to one method of counseling. In eclectic approach, what we do is we take content from different sources, amalgamate everything, and derive our own model at the end. This is called as eclectic. That means we use ideas from variety of sources. Some clue we take from directive counseling, some clue we take from non-directive counseling, some clue we also add our own thing. All the three put together will become eclectic counseling, because we are not fanatic of any particular model. We take knowledge from different sources, and take knowledge from different sources and use it for the given case is called as eclectic approach. This is called as eclecticism. We refuse to become fanatically devoted to single school of thought. One student asked a professor of psychology, "Sir, you have given us so many theories of psychology. Finally, which theory we have to follow in practice?" The question is very relevant. So many theories are there. Psychoanalytic theory, there are other theories are there. Which theory we have to follow? The professor gave the answer. First thing is, know them all. No. Know all theories. First point. Second one is, fall in love with a few. Fall in love with a few. ಎಲ್ಲ ಥಿಯರೀಸು ತಿಳ್ಕೊಳ್ಳಿ, ಕೆಲವು ಥಿಯರೀಸ್ ಅಂದ್ರೆ ಪ್ರೀತಿ ಪಡಬಹುದು. But last one is, but don't put any theory into practice. ఏ థియరీను ఆచరణಕ್ಕೆ ತರಬೇಡಿ. Know all theories, love a few theories, but don't put any theory into practice. Develop your own theory. Taking the knowledge from different theories, develop your own theory, and that theory is called as eclectic theory. This is eclecticism. Okay, now next one is how to conduct a counseling session in a college or in a university. How it has to be conducted. There are 5 tools which we use in counseling. One, interview. Second is observation. Third is listening. And the last one is professional relationship. The last one is rapport, which I explained to you already. Professional relationship means relationship between the client and the counselor must be cordial. But when you practice counseling, we use all 4 together. We don't use one after the other. We use all tools together. Okay, I will explain to you each one separately. What is interview? What is observation? What is listening? And what is professional relationship? Professional relationship I have explained to you already in the beginning, rapport. Interview means interview. Inter means between, view means understanding. Interview means it is a conversation between 2 persons with a definite purpose. The purpose is known to both the parties. A conversation between the 2 persons. One is an interviewer, another is an interviewee, or a counselor and a client. A communication, a conversation between the 2 persons with a definite purpose. The purpose is known to you and known to me also. If you want to know someone, if you want to know his background, if you want to know his personality, if you want to know his likes and dislikes, the only way that is available to you is, why don't you talk to him? And hence we say counseling is otherwise called as talk therapy. Talk therapy means here we help people through talk, because we don't have any other equipment. We don't have any other machinery. The only thing that is available to us is a sharp tongue. We talk to people. But please understand, interview does not mean interrogation. Interrogation means where you use power. But interview is not using power. Interview means it is a conversation between two minds, two hearts. ಎರಡು ಮನಸ್ಸುಗಳ ನಡುವೆ ಇರುವ ಸಂಭಾಷಣೆ ನಾವು ಇಂಟರ್ವ್ಯೂ ಅಂತೀವಿ. Interview is not interrogation. Interview is not monologue, it is a dialogue. I ask you questions and you answer the questions. Sometimes you ask the questions for which I answer the questions. This is called interview. It is not a one-sided affair. It is a mutual view of each other. It's a mutual view. I understand you and you understand me. Through interview, I understand what type of person you are and what problem you have and your background. Everything I can understand through this. So that is called interview. We have different types of interviews are there. What are the types of interviews? We have, broadly we can say there are two types of interviews. One is structured interview and unstructured interview on the basis of the type of approach we follow. Structured interview means where all questions are prepared well in advance, arrange the questions in order, and we ask questions one after the other for which the person replies. This is structured interview. Structured interview means questions ಎಲ್ಲ ಮುಂಚೆ ತಯಾರು ಮಾಡಿಕೊಳ್ಳುವುದು, ಎಲ್ಲ ಒಂದು ನಿರ್ದಿಷ್ಟವಾದ ಕ್ರಮದಲ್ಲಿ ತಯಾರು ಮಾಡುವುದು. We ask the same questions to all the persons, and whatever response we get from the person, we make a note of it. This is called as structured questions. Structured interview, the questions are in sequence. We don't change the sequence. We don't change the words. We don't change the language. We don't change anything. Everyone will receive the same questions in the same order. This is called structured interview, which is very, very easy to conduct because things are there before you. It is easy. But whereas unstructured interview, informal interview means the questions are not prepared well in advance. The questions, most of the questions are spontaneous. Spontaneous. Based on your answer, I ask you a question. This is unstructured interview. Unstructured interview is very, very difficult to do it, but unless you have some experience. Unstructured interview. But in counseling, which type of interview you use is, definitely it is unstructured interview, which is most useful. So ask questions. For one person, we ask one question. For other person, we ask the same content in different way. For one person, we ask a big question. For other person, we make that question into 3 questions. The order is changed. But finally, what we want is, we want the content only. We want response to the questions. So informal interview. We have, on the basis of function, we classify interview into 3. One is diagnostic interview. Through interview, we identify the problem. Treatment interview, through interview only, we provide treatment. That's what we say counseling. And we also have research interview. In the research, we collect the data. Interview schedule. Whereas interview is the method of gathering data. Schedule is a tool. Schedule is a document. Schedule is a list of questions prepared by the researcher, and that is filled in by asking questions. That is called as interview schedule. We also have document schedule. We also have observation schedule. We also have interview on the basis of the number of persons involved in the interview. One is individual interview, another is group interview. Sometimes you talk to one individual interview, to talk to the group of persons, group interview. And length of contact. Sometimes the interview will be a detailed interview. That's what we say. Long contact is there. Long contact means when the person comes to you for the first time, you require more time to talk to him. This is called as long contact or long-term interview. When the same person comes repeatedly, it is called a short-term interview. Short-term interview, long-term interview is on the basis of the time we spent. Generally, The time which we spend with the person is 45 minutes to 1 hour is the maximum when the person comes to you first time. When the same person comes for follow-up afterwards, we don't require 45 minutes, we require only 15 minutes only. This is called as follow-up. If you go to a doctor first time, if you go to a doctor, he requires half an hour to examine. Second time, when you go there, he requires only 5 minutes. So second time is called as follow-up. The first time is called as initial workout. Initial workout. The first workout is called an initial workout. First time. So next is on the basis of other aspects, we have focused interview. When the interview is on a particular topic only, particular issue only, particular incident only, that's called as focused interview. We also have depth interview. Depth interview means going into the depth of the issue, more analytical in nature. We also have repeated interviews where you conduct interview with the same person at different times. Today I ask you a question, how is the course? How is the teaching? I ask the same question to the same person after 3 months. I ask the same question to the same person after another 3 months. This is called as repeated interview. The questions are same, the researcher is same, the receiver also is same. Only difference is the time factor is different. This is called as repeated interview. So, friends, interview is not is a two-way communication. It is an interactional process. So, how to conduct an interview? The next one is how to conduct a session. The place of counseling session, the role and behavior expected of a counselor, the guidelines for effective interview, questions to ask, questions to avoid, effective listening and observation. First one is effective place of counseling session. There must be a definite place for conducting counseling in the college or in the university. A separate counseling room is to be allotted. The room or the cubicle must be free from all disturbances. Maintain privacy when you are conducting counseling. Privacy means ekantadalli maatanaduvudu. Make sure that the place is free from all disturbances. Avoid conducting counseling sessions during odd times. Conduct counseling sessions only during the working hours of the college or the university. Second one is the role and behavior expected of a counselor. Plan the session well. Plan the counseling session. Tell the person at what time he should come. The date, time, and place of interview must be convenient to the person and not to you. His convenience is more important. Plan your session. Conduct the session according to the convenience of the person, not the convenience of the counselor. Maintain timings. Maintain timings. Make sure that there is needed infrastructure in your counseling room. A table and 2 to 3 chairs and an almara to keep the documents. Greet the client when the person comes inside. Give him full attention. Have a small talk. When I say small talk, andre yavag badri neevu illinda bandidiri anu kelogodu. Ubaya kushilo offer. That's what we say. Ella channagidare sami ellar maneyinda. Okay, tindi aitha. Offer a seat. Be polite. Show respect to him. And maintain optimum physical distance. Sit very near to him. And it should not be very far also. Look at the person while talking. Introduce yourself. Introduce yourself properly. Tell them that you are a counselor and you are there to help them. And all ethical issues are to be explained, especially confidentiality. Confidentiality. You can trust me. You tell me whatever problem you have. Tell me in what way I can help you. ఏ విధವಾಗಿ ನಾನು ನಿಮಗೆ ಸಹಾಯ ಮಾಡಬಹುದು ಅನ್ನುವುದು. ಅಂಡ್ ಒಂದು, ನೀವು ఏ ವಿಷಯ ಹೇಳಿದ್ರು ನಾನು ಯಾರಿಗೂ ಹೇಳುವುದೇ ಇಲ್ಲ. Assure confidentiality. Plan the time properly and don't be, you should always maintain timings. Look at the person while talking. Don't exhibit any signs of exhaustion. Don't show that you are tired. Don't do any other work. Don't attend phone calls. And don't look at the door also. Don't give false promises. Observe the feelings of people, emotions of the people. Respect the personality of the person. Call him by name. If he is a very young person, call him by name. Don't dominate the conversation. You should not dominate the conversation in the sense you allow him to talk. Don't be argumentative. Don't quarrel with him. But if you want to say a point, you have every liberty to say, but not to be argumentative. Avoid long silence. There should not be long silence between you and the client. If you are looking at the client and client is looking at you for a long time, that means the counselor is not mature enough. Unless the long silence has a meaning. But here there is no meaning. If long silence means sometimes we don't know what to talk. Give ample time to respond. Don't be in a hurry. Don't accept any gifts. If you have a dress code, follow the dress code. And don't call the person over phone during odd hours. Don't make a note of the proceedings in front of the person without his permission. When he is talking, don't record it. When he is talking, don't make a note of it. If at all you want to make a note, if you feel that you may forget, then take his permission. If he permits, you can write. Otherwise, you should not. This is how you should do it. Next one is guidelines for effective interview. Guidelines will effective interview. Please understand that no client, no person will tell all his problem to you in the initial stage. First time when he comes to you, he may not explain everything, whatever is there in his mind. He will try to observe you. Innu trust ನಿಮ್ಮ ಮೇಲೆ ಬಂದಿಲ್ಲ, ನಂಬಿಕೆ ಬಂದಿಲ್ಲ, that will take some time. So don't be under the impression that the client will tell all his problems in the first attempt. Because you are a known teacher, he may tell. But if a person goes to an unknown counselor, nobody would tell all his problems to the counselor in the first instance itself. It will take time. It will take time to establish a rapport also. Okay. Next, guidelines for effective interview. There should not be any difficulty in starting a conversation. ಮಾತಾಡಬೇಕು ಅಂದ್ರೆ ವಿಷಯ ಮಾತಾಡಬೇಕು ಫಸ್ಟ್ ಅನ್ನೋದು ಪ್ರಾಬ್ಲಮ್. How to start a conversation? Don't interrupt when the person is talking. Don't deny. Don't contradict whatever he says. Don't be judgmental. Don't say that he is wrong. Allow him to talk. Even if he is talking something irrelevant, you must have the ability to bring him to the right track. Sometimes when the emotions pour out, when the person starts crying, when the person starts weeping, allow him to weep. But if it is too much, then change the topic. From the most unpleasant topic to take it to most pleasant topic, changing the topic, then the person will change his mindset also. Then after some time again you start. It means you are not leaving it. Only thing is you are avoiding the time. Okay, there should be a natural closure in counseling. Natural closure means at the end of the counseling, you have to say what we have discussed today. This is what we have discussed. Next meeting, we are meeting on this date at this time. Okay, this is called as a natural closure of counseling session. What should not be done is the counseling sessions should not be closed abruptly. Abruptly means all of a sudden you should not stop. Then what type of questions you can ask? What type of questions you can ask? The questions should be simple, to the point, nicely worded, good language. Ask one question only at any given time. Don't combine 2 to 3 questions at a time. After getting response for the one question, the second question will start. Questions must be timely, wisely framed. Don't ask questions which are very, very difficult to recollect. Things which happened so many years back, don't ask questions unless it is important. There should be coherence in asking questions. Questions should run in an order. Talk less and listen more. Avoid closed-ended questions. Open-ended questions are desirable. Closed-ended question means there is a definite answer for that, either this or that. Multiple choice questions like Uta Aita andre Agide Agilla. This is called as a closed type of question. Open type of question andre Tindi en tindidri neevo. This is called as open-ended question. Open-ended question means where the person has to think and answer. Closed-ended question means sometimes he can answer mechanically also. The questions should be trust-building questions only. Sometimes we can ask blended questions also. Blended question means closed-ended question followed by open-ended question. Your question is, do you feel happy or unhappy now? Do you feel happy? Are you happy now? For which he says either yes or yes, sir, I am happy, or no, sir, I am unhappy. If he says yes, sir, I am happy means, okay, will you tell me something? Can you tell me something more on this issue? Why you are happy? So the first question is closed-ended question followed by open-ended questions. When both the questions are there together, one after the other, it is called as blended questions. These questions can be asked. Next thing is how to questions to avoid. Questions to avoid. Questions to avoid. There are some questions which you have to avoid. What are those questions? Avoid lengthy question. Don't ask a question which runs to one paragraph. Avoid leading questions. Leading question means the question itself gives the answer. You are prompting him to give a particular answer. That's called leading question. Double questions, 2 questions at a time, don't ask. Closed-ended questions, avoid. Teasing, insulting type of questions, avoid. Bullying type of questions, that's called as frightening type of questions, avoid. Tricky questions, avoid. Too personal questions, avoid. Presuming type of questions. Presuming type of question means you presume that something has already happened and you ask a question. The last one is a blunt question. These questions are not to be asked. Okay, next one is effective listening. Listening has therapeutic value. When the person is talking, telling something, you listen to him. Sit very near to him. Show attention. Talk less and listen more. Listen to understand rather than to reply. Avoid signs of distraction. Do not interrupt when the person is talking. hold your temper, listen with the concern. The advantage of listening is, in one way, you are giving assurance to the person that I am here to help you. Don't think that nobody is there to help you. I am here. By listening, you are conveying a message to the person that you are there to help him. But listening does not mean endorsing. Listening does not mean endorsing whatever he says. So listening is related to encouragement. Okay. That is called listening. But while listening, what is to be done is, don't criticize his personal appearance, physical appearance, don't criticize. Don't jump to a conclusion in a hurry. Don't interrupt when the other person is talking. Don't express that you are really tired in the course of listening. Don't be preoccupied with something else. Don't enter into argument with the client. This is called as effective listening. And the last one is observation. Observation means it is see and don't just look. Observation is a skill. Your observation must be accurate. We have 2 ears and 1 tongue so that we can listen twice as much as we speak. The same way, we can observe a client from different points of view. Physically, we can observe how his body built, his physical appearance, his level of energy. Emotionally, we can observe his facial expressions, the eyes, the way in which he sits, that's called posture, and the lips, if tight or relaxed. Observe whether he is relaxed or tense, that also you can observe. Interpersonally also you can observe. How does the client react to the counselor? Is he reacting negatively? Is he reacting positively? Or is he reacting neutrally? You can observe. Observation gives so many things. His emotions you can observe. His facial expressions you can observe. Your face is the index of the mind. And you can read the emotions. And in this context, I have to say Charlie Chaplin's autobiography. He mentions that I like to walk in rain so that nobody can see my tears. ಮಳೆಯಲ್ಲಿ ನಡ್ಕೊಂಡು ಹೋಗೋದು ನನಗೆ ತುಂಬಾ ಇಷ್ಟ. ಯಾಕಂದ್ರೆ ಯಾರು ನನ್ನ ಕಣ್ಣೀರು ನೋಡುವುದೇ ಇಲ್ಲ. ಕಣ್ಣೀರು ಬರ್ತದೆ, nobody can see. ರೈನ್ ಜೊತೆಗೆ ಅದು ಹೋಗ್ಬೋದು. You can see the emotions of people. ಮಾತನಾಡೋ ಶೈಲಿ. So face, then now we can see the emotions of a person. This is what we say observation. And there are 3 stages of counseling. One is rapport building, that will take only 5 to 10 minutes. Exploration, this will take long time, there's about 30 minutes if it is initial attempt. Action planning, rest of the time. What is to be done in rapport building? Please understand, if a student comes to you and say, sir, I want to talk to a female only, because I'll be very comfortable if a girl comes and says that I want a female person to talk, a female counselor. Then it is your duty to provide that service. If there is no female counselor in your college, send the person to another college where such facility is available. You cannot say no to that. So that is what we say, gender preference is given in counseling. So rapport building, what is to be done? Rituals. Rituals means just ask him to come inside, have a small talk, a pleasant smile, where you talk about all ethical issues. Look at the person and talk. encourage him, and we don't rush through. We don't write anything in front of him. It is a beginning stage. ಏನು ಮಾಡಬಾರದು. That is what we say, hindering behavior. Don't attend other activities while talking to the person. Don't keep quiet without response. No expression is also not correct. Passive listening for a long time is also not correct. Discussion of the behavior from the beginning, that is also not correct. Avoid that behavior. The second stage is called as exploration, where you ask more of open-ended questions. You go into the depth, you identify the problem, you make a diagnosis. You ask more of open-ended questions. Explore the possible issues. Finally, identify the problem. Generate various causes. Identify the problem. But ಏನು ಮಾಡಬಾರದು ಅಂದ್ರೆ, don't criticize the person. Don't condemn an individual. Don't discourage an individual. Don't suggest a problem. And don't suggest a cause also. This is what you should do. The last one is action planning. Questions on probable solutions for the problem. Generate alternate solutions also. Idilla andre bere solution eno. What is the feasibility, priority, pros and cons, and finally preparing an action plan. And design and monitor the action plan. Needed follow-up also you have to plan. This is what we say, action planning. What is not to be done is, don't advise a person when it is not necessary. When the person is able to think on his own, when the person is able to provide a solution to his own problem, don't suggest a solution. And don't promise general help. And the last one is follow-up stage and termination. So the person has come to you beginning, that is called as intake. The person has come to you on his own intake. You investigate, you make a diagnosis, you treat the person, you go for follow-up, and finally you terminate the case. Okay, this is the process which you follow. But when you think that there is a danger to the self, when the person is deliberately harming himself, when the person has suicidal ideas, when he is not able to take care of himself, better always refer him to the mental health center immediately. If the person is very violent, aggressive, abusive, assaultive, refer him. Abusive means bayodu. Assaultive means wadiyodu. If the person is very cruel, when the legal issues are involved, refer him to the other appropriate place. Next one is when there is no visible improvement. In spite of your best efforts, there is no improvement in the condition. Best thing would always be say sorry and refer him to other place. Don't tell lies and keep helping him. When there is no visible improvement in the person, despite of your sincere efforts, refer the person to a higher level of counselor or psychiatrist. But when some psychiatric symptoms are found, for example, like head injury, when there are seizure, that is what we say fits, when brain illness is there or high fever, refer him to the mental health center. That is the reason I say every college must have student service center, and you have to work in collaboration with the nearest mental health center. But there are certain unethical issues also, practices. What are the unethical practices? One is client dumping. Client dumping means suddenly you leave him and say that everything is over, get lost. This is called client dumping. Leaving the person in the middle. Complete help is not given. The person is not free from the problem, but you are discontinuing your help in the middle for any reason, whatever may be the reason. You may say that your help is given, this is what I can do. This is called as client dumping. Dual relationship. Counselor should not have relationship with the client in any other way. That means if the counselor and the client both start a business outside, inside they are client and counselor, outside they are business partners. This is illegal and unethical too, for which appropriate punishment will be given if it's a counseling in advanced countries. Involuntary client. Involuntary client means some clients may not show interest, but still the boss will say, go and receive counseling. If you are the general manager of a factory or an industry, if the employee is a drunkard, you say, I'm giving you a chance, go to a counseling center, 1 month leave is given to you, and you have to come back normally, and everything will be given to you, get lost, go. The person will go to counseling center not with interest. Because you have asked him to go, he went there. That means with less motivation or no motivation. So it is involuntary client where the person has come to the counseling center with no motivation because he has been asked by his boss to attend, or he has been asked by the court to attend. The court also may say, go and take. So you go there, not with interest. Next is violation of confidentiality. This is what I say, breach of trust. The person has completely believed you and gave all the information to you, but you are leaking it to other persons. It is called as violation of confidentiality. Please understand there are some limitations of counseling also. Limitations means where counseling may not be possible to practice with people, especially persons with a psychopathic personality. Persons with psychopathic personality, your counseling is of no use or less use only. Because a psychopathic means the person is having a rigid personality. They are problematic. Most of the time they involve in antisocial activities. They are behind bars. They involve in antisocial activities. They don't follow social codes of conduct. Whatever they see, they get it. That is what we say, impulsive behavior. Lack of responsibility, lack of judgment. Frequent trouble with the law. But they have outstanding ability to rationalize their behavior. They know how to fool people. They are more intelligent. They know how to fool people. They manipulate others. They are pathological liars. Pathological liar means lie andre sullu heluvudu. Bina karana sullu heluvudu navu pathological liar. Telling lies for no reason. There is no necessity, but still you tell lies. This is called as pathological lying. For this type of persons, counseling is of less use. Intellectual disability, that is what we say, impairment of intellectual functioning, mostly present from birth or early childhood. But we calculate IQ. IQ is equal to mental age by chronological age into 100. You get the IQ score. If the IQ is 70 and less, we say it is intellectual disability. If it is 100, we say average, 90 to 100. If it is 120 means intelligent, 140 means genius. But can you give counseling for a person with the mental disability or intellectual disability? You cannot, because he doesn't understand what you are talking. It is of less use to the person. But counseling services to the parents is possible. You can give counseling to the parents. Early diagnosis is important. Parental counseling will help you a lot. Training and retraining both are necessary. And the last one is Psychosis. Can we give counseling to psychotics? That means those who are suffering with serious mental disorders? It is not possible, because psychotics live in their own world. Their world is different. They are not in touch with the reality. They have hallucinations and delusions, and their talk is also disorganized. For those people, counseling is of less use. So friends, we can practice counseling in other areas like family counseling centers, marriage counseling centers. We can practice in HIV testing and counseling centers. Crisis intervention. Crisis means unexpected things. A suicide, that's called as a crisis. Unexpected, unanticipated. It can be either positive or negative also. Substance abuse counseling. You give detoxification to alleviate, to remove all the withdrawal symptoms. Removing the toxins from the body is important, and then followed by counseling. Employee counseling, we have a methodology called as mentoring in industry.